Interface Video presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fairhope Hospice and Palliative Care, the Fairfield County Board of Developmental Disabilities, the Frankie Smith Funeral Home, Ohio University Lancaster, and Lancaster Fairfield Community Action Recycling and Litter Prevention.
Hi, and welcome to today's edition of the Fairfield Today Show. We're coming to you once again from Fairfield Medical Center. Another special day we wanted to share with you. Every March across the United States is celebrated National Doctors Day, and we're doing that here at Fairfield Medical Center today. Going to be giving away some recognitions. Some patients have wanted to recognize their doctors for the care that they provide, and the foundation and the hospital wanted to kind of give back to our physicians as well. We kind of know that it's a very challenging job. I always say that the physicians, they're front line, they see kind of the worst of the worst. So we kind of wanted to spend some time just celebrating them today. And in so doing, we invited a guest today from Louisville, Kentucky, the Laugh Doctor, Dr. Clifford Kuhn. And I feel like I can introduce you as my friend now, if that's okay.
Oh, I'm flattered. Thank you.
So I wanted to give the audience a little bit background about you, kind of help us to understand. His topic today is going to be on healthful humor. So I wanted you to kind of educate on us. What is healthful humor? What's the difference between regular humor?
Actually, the important thing is that healthful humor has nothing to do with funny. It can be funny, it may not be funny, but it has more to do with joy, enjoying a moment, getting the most fun out of a situation, even if it's a painful situation, looking for the pony in every pile of manure, the kind of thing, like that old joke. And what we're really going to share, and I applaud Fairfield Medical Center for being willing and interested to do this with for their doctors, is how you can take a more positive energy, even to the worst situation, to the bedside, as a way of sustaining your ability to be responsive and resourceful in helping the person who is in the bed, but also as a way of sharing that kind of energy and hope that it implies for the patient as well. So that's really what we're going to try to do, and share some techniques, some ideas that might help physicians do that more often.
Okay, because I kind of wondered how you were going to do that, because you think coming to the hospital, not very humorous. It's when you come to...
Well, no, see, that's the thing. It is humorous. Hospital is, especially yours. I've only been here for the better part of a day, but I can see that you have cultivated a very personal and warm ambiance here in your hospital, and you're to be applauded for that, because I think that I get a chance to see lots of hospitals in my work, and unfortunately that's still all too rare. A hospital doesn't have to be a cold, sterile, austere place. It gets that way because we sort of hold the hospital out as a place to avoid. Take this medicine or we'll have to put you in the hospital, something like that. And I can see the opportunity here to enhance what you've already started, to create a more inviting, warm place that would be a real asset to the community on lots of levels, but a real healing place that people can come to when they need to, and it's really important for the people who are manifesting those healing elements and sharing the healing strategies to also have tools to take the best care of themselves, because they need to sustain their spirit as well. And so that's why I think it's really very, very appropriate and very wise for you to invest in the well-being of your physicians.
You know, I was kind of thinking earlier, we do as patients, not just as staff, but all of us, we just assume when you need your doctor, when you call him, he's there 24/7. Yeah. There is no downtime. We just expect them to be there, and that is part of the reason I'm really glad that we are celebrating docs. Sometimes we don't think about their world, what's going in their personal life, what's And again, the things they see frontline, I think of the emergency room a lot. They're seeing some very challenging and stressful situations there, and I'm really excited just that you're going to be here to kind of help lift their spirits a bit today.
Well, again, I am so glad that you're allowing me a chance to do that and inviting me to do that, because I think that physicians are heroes. They're not the only heroes in the hospital. The nurses, everybody in the hospital setting has a contribution to make to the healing ambiance, and to celebrate every bit. I think there should be, in addition to Doctor's Day, there should be Electrician's Day, there should be bed making, and I'm not trying to make fun of that. I think everybody, well, I am trying to make fun, but there's nothing funny about it. I think everybody needs to participate in creating that ambiance, and you have certainly done that, and doctors are included in that to celebrate their gift.
Well, I got to hear Dr. Kuhn early this morning. I've got to meet him and spend some time with him a little bit. You said something earlier today that kind of caught my ear a little bit. You used the phrase "grin and share it."
Yes.
We're used to the grin and bear it, obviously.
Well, that's why I say it that way. So it ties into something you've already thought about. But grin and share it is just an exercise in demonstrating the power of a smile. If you're watching right now and you put a smile on your face and make it a huge grin, what you are experiencing in doing that is a shift in your energy. You might even feel a little surge of energy. You might feel a little lighter. You might feel, if you had a little headache or something, the headache might have disappeared for a second there when you put that grin on your face. And there are physiologic and psychological reasons for that. And so the message is, when we want to share our sense of humor, we don't always have to make a joke. We don't even always have to be laughing. It can be as simple as putting a smile on our face. Immediately, the physiology responds to that, and your immune system is stronger. And so you have a lot of things that produce better health, better comfort, better thoughts, and maybe even more creative ideas. It all happens, and it starts with a smile. And so grin and share it is just a simple exercise in demonstrating that.
So, also speaking of the smile, earlier today you said, "Go the extra smile."
Yes.
It was a comment that you made. So,
See, that's another play on something you already know, go the extra mile. And so hopefully it's more memorable to play off that.
well, Dr. Kuhn has been very, very generous to us. He has brought his book with us today, and the hospital is actually going to give this as a gift to all of our physicians in recognition of Doctor's Day. Strongly encourage you to get a copy of it. If you would be interested, just look on the website there running on the bottom of the screen, or the phone number. We'll get that to you. We do have a little treat for you. We want you to be part of this today, so we're going to hop over real quick and let you be a part of what his presentation is going to be to our physicians. So just hang with us.
Body language. Without saying a word, it can tell you so much. Like someone is having a stroke. Know the sudden signs. Learn fast. F, face drooping. A, arm weakness. S, speech difficulty. T, time. Time to call 911 immediately. The sooner they get to the hospital, the sooner they'll get treatment, and that can make a remarkable difference in their recovery. Learn the body language, the sudden signs, and spot a stroke fast.
Thank you, Reggie. Thank you. Thank you very much. It's an honor for me to be here, and let me just say Happy Doctor's Day to you. I've had a chance to get to know some of your colleagues here. We had a leadership workshop earlier today, and I got to see some of
the people who are assisting and doing their part in creating what I think is a marvelous ambience here. My hat's off to you. I get to visit a lot of hospitals, and I think you got something really good going here, something very rich and warm and personal, and so I thank the people who invited me here. I'm here to represent their affection for you, and I'm also here to represent our patients. And I just want to say, to start off, I just want to say, because I sometimes put on a red nose, I find that patients forget I'm a doctor. And I don't know what that says about us, but they do. They say, they sort of set that aside, and I get to hear stuff I never heard when I was a doctor. And I say that to say, on behalf of your patients, I think it's fair for me to say that our patients are a little worried about us. They do. I mean, they're not dumb. They see what's going on. They see that there's all kinds of economical intrusions and strictures and all kinds of things in the practice of medicine, not to mention the infusion of technology and how that sometimes gets in the way of the personal interaction. They see all this, and they see us dog-tired at the end of a long day coming and making rounds. They see this, and they say to me, you know, I worry about my doctor. And it's not like they're trying to be altruistic. They're just good people. And they want to be able to give back in some way, in some shape. And so I salute the Fairfield Medical Group for creating or at least participating in something that you call, I think, Grateful Patient. There are going to be some awards today. I know that that's not why you do what you do, and I know that from a certain medical standpoint that might seem a little cheesy because we're professionals and we're doing our job, and why should we get a citation for doing our job? But the point is this, that the patients don't want to be a drag on the system, and when they see us dog-tired, and they see us struggling under the weight of things, they maybe hold back a little bit, or they want to find some way to contribute. And so I say congratulations on those who get these certificates. Take them as an opportunity to allow your patient to feel as though they're participating in this entire healing enterprise, because patients often feel like they're just a drain. And so if not for yourself, do it for your patients, to allow them to have a role to play in this kind of a celebration of what you do. And with that in mind, what I have today on behalf of Fairfield Medical Group is for you. You know, I know it was advertised as humor or healthful humor for the bedside. And it's easy for us to fall into the assumption that that's going to be things to do at the bedside to share more humor with our patients. In fact, that's what it is. But the emphasis for me is that it will give us more to do to help preserve ourselves at the bedside. And then parenthetically, or in a ripple effect way, of course our patients will benefit. If we do a better job of balancing ourselves and handling our stress, which humor can do if we handle it correctly, then our patients are going to get more in the long run of that kind of thing, if only by a ripple effect. And let's concentrate on us. And to do that, I want to start by asking you to chew the last mouthful of food you have, put down your utensil for just a minute, and participate with me in just a very short warm-up exercise. Would you be willing to do that? I promise you that the food will be more digestible when you finish this exercise, and your digestion will go. Anybody? Okay, could you all just stand up for just a second? Now, what I'm going to do is, now you've gone for more than half a day, some of you, and your muscles, since you got out of bed, have been limbered up. But I want to limber up your smile muscles, and that's a full body exercise, limbering up your smile muscles. And I'm not going to take for granted that you've been using them as much as you could today. So participate with me in a little series of exercises that you can use any time to strengthen your smile and limber up your muscles. The first set of exercises is to raise your eyebrows as high as you can on your forehead. Just feel free to do that with me. Like the biggest surprise you've ever had has just occurred to you. And try to touch your eyebrows with your hairline. I can't do that, but you, yeah. Okay, now relax your eyebrows. Now close your eyes as tightly as you can. Squeeze them shut. Don't hurt yourself, but get all the muscles around your orbit involved in your cheeks and back towards your ears. Really squeeze, squeeze, squeeze for that long. And now open your eyes. And now take the corners of your mouth and try to touch your earlobes with the corners of your mouth. Huge grin. Really, 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 really stretch that grin. Very good. Wow, this place just lit up. Okay, now take the same corners of your mouth and try to touch them underneath your chin. Big grimace. You can feel some muscles waking up. Okay, now relax your mouth. Take your chin, touch it to your chest, and then gently look up to the ceiling. And then back down to your chest, and stretch your neck back and forth. No whiplash, just do it gently, about a half dozen times. Very good. One more maybe. Now do the same motion side to side and touch your left ear to your left shoulder and your right ear to your right shoulder. Try to bring your ears down to your shoulders rather than your shoulders up to your ears. You're really loosening up your neck muscles. That's good. We're almost done. Hang with me a little bit longer. You can get back to that food. Okay, now take your shoulders and just rotate them. Large circles. This should feel really good. It's sort of like a mini massage. It feels so good, I've discovered it's illegal in 3 states, but it's legal in Ohio. Don't worry about it. Okay, now, last set of exercises. Take your hands and reach for the ceiling. From where you are, try to touch the ceiling so that you're stretching your midsection. All right? And with your hands extended like that, gently lean to the left and stretch your right side. Then lean back to the right and stretch your left side. And if you're dyslexic, just go back and forth. Very good. Very good. Very good. Give yourselves a hand and please be seated. Thank you. Now, you have just limbered up all the muscles that could be involved in your smile. And I hope that you have occasion to smile periodically. Because what I want to share with you in the time that we have is a prescription for bringing more healthful humor to the bedside every time you go there. And the prescription is easy to remember. It's ha, ha, ha. H-A, H-A, H-A. If you follow this prescription, you will not only be able to tap into your sense of humor more often, regardless of the circumstances, on your worst day, if you want to imagine that, and you'll be able to effectively share it healthfully with patients. Deal? Okay. The HAs stand for 3 stages of this prescription. The first HA stands for healthful humor attitude. I'll come back to that. The second HA stands for healthful humor aptitude. And the third stands for healthful humor action. So, the prescription calls upon us and gives us tools to recreate our attitude about laughter or humor, and to reconnect with basic humor aptitudes that we have, and then take appropriate and helpful humor action. To the first one, why do we need to pay attention to our attitude about humor? Every one of us likes to laugh at the right time and the right place, but that's the rub. To laugh, and to laugh in a way that does not do any harm, it has to be the right time and the right place. And the bedside doesn't often present us with the opportunity for laughter. So the first thing we need to do is take a look at humor and see that humor really is a much broader, deeper concept than laughter. We say without hesitation, laughter is good medicine. Everybody kind of agrees to that, and with all the research that's been going on since Norman Cousins' book about 40 years ago, there's a lot of reason to believe that. Laughter reduces our stress, it boosts our immune system, it relieves pain, it decreases our anxiety, it stabilizes our moods, it rests our brain when we indulge in humor, it inspires our creativity, it maintains our hope, it bolsters our morale, it sustains our resilience, it offers us a healthier long-term perspective. All of that has been documented. So we don't have any trouble in general accepting laughter is good medicine as a generalization. But it's a misnomer because it's usually referenced to a book in the Old Testament, Proverbs. Proverbs is, I think, the origin of that notion. But when you look it up in Proverbs, it's the 17th chapter, 22nd verse, if you ever want to look it up, it doesn't say a thing about laughter. It says a happy heart is good medicine. A cheerful mind works healing. And that's important because the first thing we need to do is recognize that humor doesn't necessarily involve laughter. That frees us up to look towards humor with a little more reliability and to trust it a little more, even in situations that aren't funny. You know, I've learned a lot of things from my medical school professors, but a lot of the things that pertain to what I'm talking about right now, I had to go outside the medical world to learn. And I've been very fortunate to have a lot of comedians, performers, successful performers, cross my path and teach me about how humor works. And one of the things that happened to me, I took a sabbatical back in the mid-90s and went on tour for 6 months as a stand-up comic. I wasn't very good, I'm still not very good, but good enough to be an opener in a show. If you've ever been in an opener or been to a comedy show, you know the opener is forgettable. The opener comes up, warms up the audience for about 10 to 15 minutes, and hopefully the other two performers are good enough that you forget about the opener. And he or she is just learning how to do it. And so that's what I did. I toured for 6 months as an opener. And I remember I'd been doing it for about 2 months. And I worked with a very experienced comedian who was an excellent teacher. And about halfway through the week, we were working, it was in Detroit, at a club called Chaplin's in Detroit. I remember he's sitting across from me, and he says, "Hey, Cliff, now that I know you, I have a question for you." And I said, Jim, yeah, what? And he said, "Do you ever think of telling the truth up on stage?" I said, "What do you mean?" He said, "Well, you tell a lot of lies. You tell a lot. Now that I know you, you tell lies about yourself." I said, "Well, you know, the whole idea is to make them laugh and set it up, and it's artistic license." He says, "Oh yeah." He said, "I understand that, but you have to understand that making somebody laugh is one thing. Sharing laughter with them is something else. And if you really want to be good at the stand-up part, you have to see the difference." He said, "And you're working too hard at it." He said, and when you get up on stage, the effort shows through. And people are pretty decent. They're not going to laugh if they see you making an effort. It has to look like you're having fun. And then people will join in. People will find you approachable. And he said something very apt to what we're talking about right now. He said, "In fact, it's more important to have fun up on stage than it is to be funny." Now, in the end, you have to be funny in order to get jobs, but it's more important for your success to have fun than to be funny. And I would say the same to us. When we want to take healing energy, that we're going to call humor to a bedside, it's more important to focus on joy rather than jokes. Because joy is so much broader a category. You don't have to be laughing to enjoy a moment. You can see a beautiful sunset, and for that moment, you may not be laughing, but you are enjoying. You're uplifted. You have the experience of touching your sense of perspective and whatever else, and you feel uplifted. And that's joy. Now, your sense of humor, I think, is a tool, and if you use it helpfully, you'll become more interested in propagating and encouraging joy than jokes. So I guess the first thing we have to encounter here is we don't have to be comedians to bring more humor to the bedside. We don't have to remember the punchline of a joke. In fact, at times, jokes are inappropriate anyway. So what can we do to open ourselves to the broader aspects of our sense of humor and share that kind of healing spirit? Well, the first thing we got to do is open our own hearts to that. The first thing we got to do is embrace our own sense of humor and endorse it again. Remember, we're good students, and we've learned since the first day of school in our whole lives that humor is for recreational purposes only. That's really been the essence of what we've been taught. And again, that sort of makes it frivolous, that sort of makes it irresponsible, and we categorize it as something we only do when we're off the clock. Well, we work long hours, and there are days when we're not off the clock very much, and so we don't have, if that's our definition of humor, we don't have a lot of opportunity to exercise it. And the way I've learned to adjust my attitude is I've made it a habit to ask, no matter how dire the circumstances, how painful they might be, how challenging they might be, to ask one question: where's the pony in this pile of manure? Now, some of you know that's an old joke. Little boy wants a pony for his birthday. He asks for nothing else but a pony. And on the morning of his birthday, he awakens to his bedroom filled to the ceiling with horse manure. Undaunted, this little guy jumps out of bed, still in his pajamas, and starts digging with his hands through this fetid pile of smelly stuff. His father says, "Son, what are you doing?" He says, "With this much horse manure, there's got to be a pony in here somewhere." You know what? I wouldn't want to shake hands with him right away, but he's right. That little boy is right. Every pile of manure that comes across our path, every unwelcome circumstance that we encounter has a pony in it. Will you always find it? No, I can't promise you that. But I can promise you this: you'll have a different energy if you're looking for it. It might be the difference between a reluctance, "Oh, no, I took care of this yesterday, and here it is back in my path," versus, "Well, I wonder where the pony is in this pile." That's a different energy. It's an energy that isn't laughable, but brings more hope, more openness, more possibilities, and can give you a more positive energy as you dig back into the pile, even though you thought you'd taken care of it yesterday. That's the kind of attitudinal shift that allows you now to tap into your sense of humor. So, focus on helpful humor, because helpful humor focuses more on joy than jokes. It focuses more on common ground than it does on differences. And helpful humor is essentially victimless. We don't make fun of anybody. We don't laugh at anyone. Helpful humor, everyone can participate. We celebrate our common frustrations, our common grounds. If you begin to focus on that, you will change your attitude about your sense of humor. It'll become a more responsible tool for you. And if you do that, then to manifest its benefit, you move to the second ha, And the second ha has to do with humor aptitude. Now, you sit here and say, well, I don't tell a joke well. You don't have to be funny. That's nothing to do with the humor aptitude. Your humor aptitude has to do with your ability to play. And it's something you were born with. It's something no one had to teach you. And in fact, we had to teach you, like we said, when you got to school, to stop playing. We had to teach. Remember how our school teachers reacted to our fun lovingness when we got to school? Wipe that smile off your face. That was, save it for the playground. That was a big one. You think that's funny? I'll show you what's funny. They never showed me what was funny. I don't know about you, but there was a suppression of it as being inappropriate when we had serious challenges in front of us. Well, we've already changed our attitude to be willing to say there's something about humor that gives us more tools and more options if we allow it, if we tap into it in a helpful way. So we've already set that aside. And what do I mean by humor aptitude? Well, I mean something as simple as your smile. That's why I had you warm up your smile. Don't ever underestimate the power of it. A smile is a silent acknowledgement of hope. It actually, if you intentionally smile, instead of waiting for something to make you smile, you'll be losing your mind.
Well, I just want to thank you personally. You've brightened my life a little bit today, and I am sure that the physicians are going to really benefit from your comments today.
Well, I benefited from being with them, so I hope it worked both ways.
And thank you for joining us. Hopefully you also received a little brightness to your day as well. Join us again the next time, and we'll see you then.
Interface Video presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fairhope Hospice and Palliative Care, the Fairfield County Board of Developmental Disabilities, the Frankie Smith Funeral Home, Ohio University Lancaster, and Lancaster Fairfield Community Action Recycling and Litter Prevention.